Today I am going to demonstrate application and removal of B-Hex in this cataract with small pupil. This cataract is grade 2 nuclear sclerosis. This is a 2.8 millimeter keratome. The main incision is placed here at around 11 o'clock. A side port is made 3 clock hours away from the main incision. Phacoemulsification. The patient is under topical anesthesia, and this is phenytoin, which contains xylocaine, phenylephrine and tropicamide, and there is no dilatation of the pupil with these Netrajyotics. An air bubble is injected. And the trypan blue dye is applied not only over the anterior chamber, we have to go under the iris and inject a bit of trypan blue under the iris so that the other parts of the capsule is also stained. The dye is washed out. And I have decided already to use a pupil expansion device, that is B-Hex, invented by Dr. Suven Bhattacharjee, a hexagonal pupil expansion device. The antechamber is underfilled and some visco is injected under the iris so that there is some space under the iris to enable me tuck the flanges. I have to hold a flange, a tab, and I usually hold the middle tab. Take it completely in the anterior chamber and tuck. This flange is being tucked under the iris and direction is towards 7 o'clock. This flange is tucked under the iris and is directed towards 2 o'clock. Cornea jalda. And one more flange here. Hold it and tuck it under the iris. And the pupil takes this hexagonal shape. Size of this pupil is 5.5 millimeter, and we can get a rhexis of 5.5 millimeter if we go along the border of this pupil. Now I am using this utrata forceps to do the rhexis. Pierce the capsule at the center, go towards 4 o'clock, hold this tag and guide this tag anti-clockwise all around. And get a rhexis of about 5.25 or 5.5 millimeter. And now is the time to do hydrodissection. I could see the fluid wave go to the other side, tap the nucleus, some more hydro this side. And now I try to rotate the nucleus, and I find that it is rotating nicely. Now we are going to do direct chop of this nucleus. Some superficial cortical lens matter is removed. And now we have to hold this nucleus at the central part because the peripheral parts are soft. So I go from here, stop here and hold the nucleus and chop it. And now I hold this semi-nucleus at the central part and chop it into two halves. And this fragment is emulsified. Ultrasonic energy is set at 60%, flow rate is 45 ml per minute, and vacuum is 450 mm of mercury. Turn the semi-nucleus, hold it at the central part and chop this. And emulsify this piece. And now we have to remove this epinuclear shell. It has come off. We have to be very careful when we try to hold the epinuclear shell. 330 Phaco 2 karo. Irrigation instruction. So most of the cortex from 1 o'clock to 9 o'clock or 10 o'clock has been removed. A bit of cortex is there, subincisional cortex. You can remove this by manual IA. You have to lift this wound and place the irrigation like this. One flow goes towards the capsule, the other flow, and we can hold this and remove this cortex. Now, whenever there is B-Hex in the anterior chamber, it's a good idea to use visco to implant the lens and to enlarge the main wound a bit so that the cartridge goes beyond the B-Hex ring. This is a sensor single piece intraocular lens. Leading haptic goes, and the trailing haptic goes beyond the B-Hex and goes into the back. Rotate the nucleus. Now we have to remove this B-Hex ring. easy to remove it. You have to hold one flange which is above the iris, pull it towards center, go above the iris and tug all flanges. Hold one flange and gently pull it out. There's some pigment dispersion. It happens. You have to remove this pigments to go behind the lens and irrigate the capsular bag to remove any viscose staying there, remaining there. Now see, there is no sphincter tear. The pupil is round and central and same size pupil. This is the beauty of B-Hex. It causes mild stress of the pupil, moderate dilatation of the pupil, and doesn't cause sphincter tear. This is the final wash. Again, I will go behind the lens, irrigate the bag and use the aspiration in front of the lens. So we are done. This is সোজা তাকান, খুব ভালো তাকিয়েছেন আপনি. This is moxifloxacin. The side port is closed by hydrating corneal stroma. Final lavage. The antechamber is formed nicely. Integrity of all the wounds are checked. Few drops of moxie is applied over the cornea and the case is concluded. Thank you very much for your attention.